Hi everyone, welcome back to my YouTube channel. So today we're going to be talking about a condition called GERD or Gastroesophageal Reflux Disease. This is a condition that affects millions of people worldwide. So just imagine this. You've just enjoyed a delicious meal, but instead of feeling satisfied, you're hit with a burning sensation in your chest and an unpleasant taste in your mouth. Does that sound familiar? You might be dealing with GERD. So let's dive in and learn more about this condition. What is GERD? It's a chronic condition where stomach acid frequently flows back into the esophagus, the tube that carries food from your mouth to your stomach. This backwash is known as acid reflux, which can irritate the lining of your esophagus. While occasional acid reflux is common and can happen to anyone, GERD is characterized by frequent and severe symptoms. If you experience acid reflux more than twice a week, you may have GERD. What are the causes of GERD? The primary culprit behind GERD is a malfunctioning lower esophageal sphincter. We call it the LES. So the LES is a ring of muscle at the bottom of the esophagus that acts as a valve between the esophagus and the stomach. Normally, it opens to let food pass into the stomach and then closes to prevent stomach content from flowing back up. However, when the LES is weak or relaxes inappropriately, stomach acid can flow back into the esophagus, causing GERD. Several factors can contribute to this, so let's talk about those factors. Number one, lifestyle factors. Smoking, consuming large meals at once, eating late at night, eating fatty or fried foods, drinking alcohol or coffee, and certain medications can actually weaken the LES. Number two, your diet. Spicy foods, citrus fruits, chocolate, carbonated drinks are also common triggers. Number three, obesity. Excess weight can put pressure on the abdomen, pushing stomach contents into the esophagus. Another one is hiatal hernia. This is a condition where part of the stomach pushes up through the diaphragm into the chest, which can also cause GERD. Pregnancy. Hormonal changes and increased abdominal pressure during pregnancy can also lead to GERD. What are the symptoms that we notice for someone who has GERD? GERD manifests in various ways, but the most common symptoms include heartburn. That sounds very familiar. This is the most common symptom people complain about: heartburn, which is a burning sensation in the chest, often after eating, which might be worse at night. Regurgitation is sour or bitter tasting acid backing up into your throat or your mouth. Chest pain, discomfort or pain in the chest, sometimes mistaken for heart issues. A lot of people end up going to the emergency room because they think they're having a heart attack, but they don't know that it's just GERD. Difficulty swallowing, so they have that sensation that food is being stuck in the throat. Another thing is persistent cough that is not linked to any kind of respiratory issues, but they just keep coughing. Or sometimes people might complain of even sore throat or feeling like they have a lump in their throat, like something is just being stuck there. Some of the less common symptoms that we might see include nausea, hiccups, burping, or bloating. How do we diagnose GERD? So it's typically diagnosed based on your medical history, physical exam, and if your doctor suspects GERD, sometimes they might recommend, okay, why don't we do an endoscopy, which involves putting down a flexible tube with a light and camera inserted down into your throat to examine the inside of your esophagus and your stomach. Sometimes it even helps to identify ulcers or even other complications of GERD. Or they might do a barium swallow, which means you drinking a barium solution where they take different x-rays to help. This solution actually helps to coat and fill the inside lining of your digestive tract, which helps your doctor to see, your esophagus, your stomach, and your upper intestines. What are the complications of GERD? If not treated over time, it can cause esophagitis, which is an inflammation of the esophagus that can lead to ulcers and bleeding. It can cause esophageal strictures, which forms scar tissue that narrows the esophagus, making it very difficult to swallow. And it can also lead to Barrett's esophagus. This is like a severe form where you don't even want to go because it increases your risk for esophageal cancer. And also respiratory problems, which it can cause like asthma, chronic cough, and other respiratory issues. How can we treat GERD? It often starts with lifestyle modifications. And here are some steps that you can take. Dietary changes such as avoiding trigger foods like spicy foods, citrus fruits, tomatoes, chocolates, garlic, onions, caffeine. Try to eat smaller meals more frequently and avoid eating at least 2 to 3 hours before bedtime. If you're overweight, try to lose weight. Losing excess weight can reduce the pressure on your stomach and lower the risk of acid reflux. Also, try to elevate the head of your bed at least 6 to 8 inches, which will prevent acid from flowing back into your esophagus while you sleep. Also, we can use medications such as over-the-counter antacids like Tums. We can use H2 receptor blockers, medications like ranitidine, famotidine. It reduces the amount of esophageal lining. So let's talk about some myths that are out there. There's a lot of acid that your stomach produces. Most commonly what we use though are PPIs like the omeprazole. Those ones are more effective than the H2 blockers, which can even help heal the misinformation. One myth is, oh yeah, GERD is just a heartburn. No, GERD is a chronic condition that can cause serious complications, which I listed. One of them is Barrett's esophagus, which can increase your risk for esophageal cancer. You have GERD, you better treat it immediately. Another myth is, oh yeah, GERD can only occur in people who are overweight. No. While obesity is a risk factor, GERD can affect people of all body types. One last myth is, oh yes, drinking milk can relieve your heartburn. Yes, it can provide temporary relief, but at the same time, it can stimulate your stomach to produce more acid, which can potentially worsen your symptoms. What are some strategies or lifestyle changes that we can do? Maintain a healthy weight, eat a balanced diet, exercise regularly, avoid smoking and drinking alcohol because it can weaken the lower esophageal sphincter and increase acid reflux. Manage stress. Stress definitely can worsen GERD symptoms. So practice relaxation techniques such as deep breathing exercises. In summary, GERD is a manageable condition with the right approach. If you're experiencing symptoms, don't hesitate to seek medical advice. Remember, effective treatment and lifestyle changes can make a significant difference in your quality of life. Now, thank you for watching. If you found this video helpful, please share it with others who might benefit. Thank you so much.